Okay, have you heard about people who get vitamins, minerals, and medications with needles? No, hold on just a moment. We just lost several people who said, don't say the needle word, right? And that is one of the problems, isn't it, Dr. Jennifer Burns? People have a fundamental fear of inoculations of any kind.
Yes, that is true. So I've had several people who, as soon as I say the word needle, they turn white. So, or they get a little lightheaded and they're just like, oh, you know, what are you going to do to me? So,
yeah, all right. But there's some real positive things involving nutrition applied intravenously.
Yes, that is true. So there's a lot of benefits to it that we have. What we do is we make a bag, what we call a cocktail of vitamins.
And who is we?
We is a lot of the naturopathic doctors. We call them cocktails, or the new term is intravenous nutrients. Mm-hmm. So we're basically taking all your vitamins, and instead of you taking a capsule, we give it to you through your vein.
You changed the name from cocktail to intravenous nutrients because you didn't want people disappointed when they didn't get a martini, right?
Exactly. So, yeah.
Is it more effective than ingesting vitamins?
It can be more effective than being vitamins because we're bypassing the digestive system, and actually the cells are getting immediate benefit from the vitamins that are there. If you're taking a capsule, you're looking at least 30 to 40 minutes for people to even start getting the benefits from it, because it has to go through the digestive system before the nutrients are released in those capsules.
Okay, we all know about one-a-day vitamins.
Yes.
Do you have to get an inoculation? Do you have to get these intravenous injections once a day?
Some cancer patients that I see do get them once a day. Other people who have, been to a party the night before or something like that, probably only need to get them.
Wait just a moment. Lisa,
every once in a while.
Laura, excuse me. There's still hope. It's over at Dr. Jennifer Burns' house.
Here we go.
Well, we were out last night. What would you give us? And I don't mean necessarily for hangovers, but everybody's kind of dragging around today because we got in late and we ate a lot of rich food.
Oh, yeah, something like that. I would probably put in a little bit of vitamin C with some B vitamins, a little bit of magnesium, just to kind of, get everything going, get your energy going and stuff like that. Usually it takes about 20 minutes to get an intravenous bag, so just for the normal person. And a lot of people feel a big energy boost afterwards.
Okay, now listen, I know that it's important to take care of the Burns family, but do we have to go to your office or another office to get this done? Or can we mix up the potion ourselves and give it to us intravenously if needles don't bother us?
No, you actually need to go to a doctor's office to get this done. You can't, just buy everything over the counter and make it yourself. So,
why?
Because it's strictly regulated as far as the amounts go with the intravenous. So it's by prescription only.
In fact, even something that would seem as benign as vitamin C, you can over-inject yourself, can't you?
Yes, you can, especially if you don't know the right amounts of it. I mean, yes, taking it orally, the only thing you get is diarrhea from it, but there's the dangers of, is there too much air in the tube? Is it dripping too fast? It's like if a person only has one kidney, it's like how should they be rating it? Which is why we have medical teams that are actually trained in how to do this.
You've convinced me.
Okay.
But what's the downside of the whole thing? Are there people who just shouldn't try this?
Well, people who are missing an enzyme to clot their blood, if they get a little prick, they bleed out a lot. Those are the types of people who probably should not be getting one. But
it would be the
everyone
injection
else.
itself as opposed to the nutrients.
Yeah, exactly. So, but no, most everyone can actually get the nutrients. It doesn't matter who it is.
It's most effective other than just simply post-party.
Yes.
It's most effective for what conditions?
It's most effective for basically anyone, if they're dehydrated, if they're just needing an energy boost, cold or flu, anyone who has any gut issues, regular headaches, stuff like that.
And if you're inclined to have a particular condition chronically, Do you have to be careful about doing this too often?
No, actually, like I said, I have cancer patients who do it every day or like every 3 days. So it just really depends on the person.
All right, well, it's also dependent on one's budget too. How much does it cost?
Normally, they charge somewhere between like 125 to probably about $200 to $300 a bag. It just depends on which doctor you go to and what all is actually in there.
Now, when you say X amount of dollars per bag, then you're talking about this cocktail, this combination of nutrients in a drip bag,
Yes.
right?
Yeah.
And so it's elevated like the ones we have in the hospital
Yes.
when we're trying to hold our gown closed in the back and
Yes.
walk down the hall like this.
Yes. So when you come into my doctor's office, you do not need to be in a hospital gown. All you do is just roll your sleeve up unless you're wearing short sleeve shirts. So you can be in normal clothes, and then you just kind of sit back and relax for about 20, 30 minutes and just let the nutrients go in and let them do their job.
Okay, if I don't go to Dr. Burns' office and if I go to my family practitioner, what do I ask for?
A lot of times the family practitioners aren't trained in doing that. Most people, like I said, yeah, as you were saying, get them in the hospital, but a lot of naturopathic doctors and a lot of homeopathic medical doctors are trained in the intravenous nutrients. So a regular family practitioner may or may not offer them, but more the alternative holistic doctors will.
So when Dad says, listen, honey, I'm going to go out for a shot, it may not necessarily be anything recreational. It might be something like an intravenous nutritional experience at an office like Dr. Burns. This is Pat McMahon. My office has the Group Scoop coming up in just a moment.